Hello there, this is D, and welcome. I have to learn how to say welcome. Welcome to episode 128 of the Benzo-free podcast. I'm so glad you're here joining us. As you can see, I am on the video. Something I haven't done in a long time on the podcast, but something you will start seeing more of as we do more content, more video content, and a lot more coming up. I'm really excited about it all. Today we have Doryn Chervin on our podcast today, a woman who I started working with about 6 months ago on easing anxiety, and we're developing a lot of infrastructure. And long story, and we'll get into some of that today and definitely on our next podcast. But I just wanted to kick this off really quick and let you know that I am using a new software on here, which is called StreamYard. And I hadn't used it in a couple of years, and so I don't always know the right button, and sometimes I hit the wrong thing. And in fact, this is actually being recorded after the second half of this episode. I seem to have I took a pause when we recorded this morning, and when I came back, instead of continuing, I hit the wrong button, which said restart, and it overwrote the first half of the podcast. So Doreen was kind enough to come back on later today and talk with us more on that, on the topic, the stuff that we missed. So we're going to re-record that first 20 minutes of the podcast until that break, and then you'll see the rest of the podcast. So I'm really looking forward to that, and I'm sure it's all gonna turn out fine. So I just want to thank you all for joining us today, and I think today would be really informative to learn about Doreen, her background, and all the stuff that's going on. So, but we're going to move right in. Let's not delay any longer, and let's jump in and join Doreen on the call, and let's do a brief introduction with that. Hi, Doreen. How are you doing?
Steve. How are you?
I'm doing good. Good to see you again. Now
Again.
that we are re-recording this, and thank you for your patience. I appreciate
No
that.
worries. No worries.
That's very kind of you. So I'm going to jump in real quick and kind of go back and talk about your background and your bio and your involvement with the Alliance and
Okay.
your history and stuff like that. We're just going to kind of cover some of that information so people in the podcast get a chance to get to know you.
Good.
Okay. So my first question is, let's talk about your background, especially the career you've had, your education, and all the work you've done. Just tell us some about yourself in that regard.
Okay. So my career was I started with I have a doctorate in public health, and uh, prior to that I got a master's in guidance and counseling and a degree in psychology, all from Texas universities. And the reason that that's important is that I really started out in psychology wanting to help individuals. And as I had some really important experiences that helped me realize that I thought if I could put my efforts to helping communities and populations, that that would be where I wanted to spend my time. And I was very intrigued by the idea of preventing problems rather than dealing with the aftermath of problems. So that's why I went into public health. After I got my doctorate, I went to Stanford University to set up a health promotion program there. And then went, I was in a number of organizations that essentially worked for the federal government to do um, public health strategy, program development, and evaluation. So I worked with groups like the Centers for Disease Control, the Substance Abuse and Mental Health Services Administration, many of the large HHS, Health and Human Service agencies. And so I did that for 40 years, and I'm pretty much at this point retired from that, but still uh, eager to apply my skills to things that are important, like the work we're doing together.
No, it's so good to have on the team and working and doing the work we're doing. You had written a blog post or a couple of blog posts on suicidality, and also I know you have some background in that. Can you elaborate on that a little bit for me?
Yeah, thanks. I was, for 3 years, I really had the privilege of being the director of the National Action Alliance for Suicide Prevention, which is a very large public private partnership uh, to address the issues of suicide prevention in the United States. So the public part of that was all the health and human services agencies that are concerned with any aspect of suicide. The private part were all the national organizations that have anything to do with suicide, like the American Foundation for Suicide Prevention or the Trevor Project, but also many of the large industries where people can be vulnerable and where people can also where their needs can be identified and addressed. So was the with the railroads, the National Railroad Association and the NFL and really the big organizations all coming together to develop policies and direction to help stem the issues of suicide in this country. And as you well know, the issues that we deal with the benzodiazepine community
Yeah.
uh, make make us all vulnerable to suicide.
Absolutely. Absolutely. Yeah. Let's move a little bit into you had direct experience with benzodiazepines. So
Yes.
can you share some of your benzo story for the rest of us so they can kind of get up to speed and
Yes.
understand you a
So
little better?
probably 25 years ago, maybe. Um, I was really struggling with fibromyalgia, which was really chronic pain, cognitive fog, chronic exhaustion, and but I also had to be extremely productive at work. I never I couldn't not be productive. And so when I spoke to my internist, she was she prescribed a benzodiazepine, clonazepam or clonopin, many of you know, and to help with the muscle pain and kind of all the emotional issues around fibromyalgia. And I was on this benzodiazepine for so many years. After a while, I noticed that I couldn't tell that it was really helping. But more importantly, as I was getting older, I started looking at the literature, the evidence around long-term benzodiazepine use, and I got pretty worried, especially when I was looking at the at everything we know about benzodiazepines in older people, where benzodiazepines are associated with falls, motor vehicle accidents, cognitive impairment, and so I really decided to go on the journey to get off of Klonopin. And as I've said to you before, you know, I really had the benefit of um, a lot of personal
Mhm.
uh, choice where I could find doctors that I wanted to work with that would work with me based on the things that I thought were important. That if there was a doctor that wouldn't uh, do things as slowly as I wanted, I really could make that choice. And not everybody has that choice. And I
Right.
think that's really important. I was very influenced by the Ashton Manual. I read your book, which was very helpful. And so I embarked on this journey, and it took me two very long, deliberate, difficult years. I was able to get Klonopin in through a compounded pharmacy in a liquid version, and was able to micro taper. And it was a very deliberate process. You listen to my body. When I couldn't do cuts, I wouldn't. Um, but it's been 2 years now. And one of the things I do want to say is even though it is difficult, and some people have much more challenge than I do, I just want to say to people, it's really possible to heal from benzodiazepines and to feel like you're living a rich life. And not everybody has the same outcomes and benefits. Some people still continue to struggle. But that's kind of the benzodiazepine life.
How are you now? How would you consider yourself? Do you still have any symptoms or are you
Yeah. Sometimes I have uh, irritability and
Yeah.
a little bit of agitation.
Okay.
Um, and sometimes it's hard to parse out what is life and
I know.
what is
Yeah.
the, but it feels like it comes out of the blue, and it feels very, much like my neurologic system is activated. I think it's very hard to ever know if if it's net neutral, if you can get off them and you're just it's never an effect anymore. So, but I know other folks just struggle with even when the benzodiazepines are out of their system.
Yeah.
Mind is a real and challenging issue.
Oh, yeah. I think we all know that. I'm 9 years and still have, had the
Okay.
recurrence recently to setback, and it's just kinda
You really have, and
it's a struggle. Yeah.
it's really hard to keep your perspective and spirits up when you feel like something's happened to you and you're doing everything you can to make it
Yeah.
be strong.
Especially when you feel like you've, been progressively improving over years and you think you're 90% or whatever back. And then you have that downturn or setback. And I don't want to say it's extreme, it's just more you're backtracked a little bit. Like long COVID. I've talked to so many people with COVID has set them a little back. For some people it's stress of, the events of the world and stuff like that have sent them back. Some people it's an illness of some kind that has sent them back. And that's very distressing, for the individual because you've come so far and you've worked so hard and it's been so difficult to get here, you
Yeah.
know.
And
But
one of my personal coping strategies is really to assume that has nothing this is not necessarily true, but this is how I cope, which is to assume it has nothing to do with benzodiazepine injury, but that it is the ebbs and flows of life.
yeah,
But the reality is that I was on a benzodiazepine for over 25 years, and that's got to make a
yeah,
difference.
no, there's definitely some. Yeah, for me it was 12. You had me beat there, as far as but we
Yes,
don't know.
honor.
Yeah, and we don't even know what duration or dosage. We still don't really know what effect that has on people's outcomes. It's, some things seem to say that it has an effect. Some things seem to say they don't as much. Because somebody at 2 to 4 weeks can wind up with symptoms, can wind up with dependence. And yet, I know of people who have been on it for 10 years who came right off the drug with very little problem.
Right.
There's so many factors that we still haven't figured out.
Well, I think we're on a journey to learn, and we, through Easing Anxiety and the Alliance for Benzodiazepine Best Practices and BIC, we're all really working to make sure
Right.
that there's attention. And FDA has really taken up the mantle with the boxed warnings to say that there's something going on here, and this is a really important area for investigation and attention.
Yes, absolutely. The 2020 warning was really beneficial. We all wish it would have gone a little further, but it's the first one to have admitted or said that there is long-term complications, and these are something you have to be cautious of, and we need to be careful of that.
And it
And
shouldn't be prescribed for more than 2 to
yep,
4
that
weeks.
too. You
That was
bet.
huge, I think.
Yeah, so I think that's really great to have that. You just brought up my next topic, which is the alliance. So you're involved with the alliance. I think you're on the board there. Why don't you tell me a little bit about the alliance and how you got involved and what your role is there?
Yeah, I've been on the board for, 4 years, and I got involved with the alliance because I really, as I said, prevention is a really big value of mine. And so while I was in the process of tapering, I really felt like I needed to understand more. And as I found out what kind of where was the evidence base about what works and what doesn't around benzodiazepines and benzodiazepine tapering, I found out about the alliance, and I was really attracted to it because of its values around trying to help providers understand that they can make different decisions than prescribing benzodiazepines, and that there is something to be said for giving people tools and skills to deal with the whether it's anxiety or insomnia or pain or whatever reason somebody is prescribed, that there are different strategies. And so I went to the Alliance and then quickly became a part of the board and have been working with the Alliance around policy development, around legislation, trying to look at legislative issues. We have recently just were awarded a grant from FDA through the Safe Use Initiative to work with Kaiser Permanente to do a project to see how healthcare providers can be influenced to make a range of decisions before they prescribe benzodiazepines. So
Yeah, that's
um,
fascinating.
we
I know
started.
yeah, Bernie Silvernail, who's the founder and of course you
Yeah.
work with and I work with all the time, but yeah, he was cluing me in on that a couple times in our recent meetings. And yeah, I think that's great that tie-in with Kaiser and of course their data, their patient history, they have such a closed loop that they really have a great model for research, because of the way they do business. So it's a great method and I think a great
You know,
opportunity.
and one thing, and we should probably talk about this on another podcast, but one
Sure.
thing that's really interesting about this is that it really acknowledges the idea that it's not just that any individual healthcare provider can't necessarily uh, just know how to treat the issues that the complex issues that they're faced with when they have 8 minutes to see a patient. So if
Yeah,
somebody comes in with really chronic anxiety and yet the provider has 8 minutes to address it,
right.
it's a really tough structural issue in the system. So what this project is going to be doing is to have, how in electronic health records you have to sometimes answer questions before you can go, the provider has to answer questions before they can go further. Well, in this case there's going to be kind of a stop when a provider is make is maybe deciding to prescribe a benzodiazepine, to give them some kind of thoughts and strategies about making other decisions before a benzodiazepine is prescribed. And if a benzodiazepine is prescribed, to offer a care plan to get them off within a
Good.
short period of time. Anyway, it's
It's a bridge
an
drug. We wanna
exciting
make sure that
project.
yeah. Yeah, give them a 30-day supply or something, but make sure that you also leave them with instructions on how to get the long-term help so they don't have to be on the drug longer than a week or 2. 'Cause that
Absolutely.
so often doctors sometimes will say it's a bridge drug to get you on therapy, but then the follow-up isn't always there, or the
Yeah,
instruction on how to do that isn't always there.
yeah.
And I think that's so important for people to have when they're going in. That's great. And so, yeah, and so, you and I know each other, and I was going to talk about that transition a little bit. And so, I've seen you several times on some of the work groups, the Benzodiazepine Action Work Group. I know you've been in those meetings,
Yeah.
and of course, I knew were on the board with Bernie, and we kind of seen each other around. But then, um, I think we were both a little bit interested in what each other was doing, and I got an email from you about wanting to have a conversation. What drove you to do that, and then where did that go? So.
Well, I just was really interested in the approach that you take, which is not just around, so you started with your book and then the Benzo Free podcast, but you really shifted to the whole issue of anxiety as a broader topic. And I would just really wanted to get to know your perspective better. And so we reached, and then we had a lot of synergies in our perspectives and interest in doing something different and perhaps new for the community that we want to build.
Yeah, I agree. We just started meeting. It was kind of an interesting process. We started to meet once a week and we just chatted at first. It took us probably a month or 2 just to get to know each other and
Yeah,
kind of see what were you wanting to do? What was I wanting to do? How did that cross over?
yeah,
And I think we started to realize we enjoyed working with each other and it just kind of kept developing and kept growing. Um, and
and
I
you said
Go
this
ahead.
forgive me. You said that we really have very different professional backgrounds,
Yes.
but and which is very complementary. But by having lived experience, that creates, and both of us were on Clonopin, which is
I know.
interesting. Um,
Which
and
is not that unusual,
not
unfortunately,
that
but yeah.
unusual, not that
Yeah.
unusual. And and so it brought us together in pretty complementary ways.
I totally agree, and I think that was yeah, and it's funny because that process that we kinda developed is the process we've been now using with other people that we've been starting to have conversations with to bring them maybe on board or to partner with, and some of them have their own organizations, and we're just looking to partner with them and work, which we work with one thing, as you know, from easing anxiety, our main goal is just to be part of the community, and we don't see anybody as competition. It's all, if we can promote another benzodiazepine organization
Absolutely.
or YouTube channel or coaching, whatever, we're happy to do that, and they're happy to do it with us. And it's just, we're building this community. And I think that feeds into our general approach, which is, there's no one way. And that, so if somebody comes to us, like I use this as an example a lot, but if somebody comes to me that's maybe a veteran, who's having some, anxiety problems, maybe benzo problems too, but also has that, maybe PTSD or something out, I'm going to probably say, you know what, we're happy to help you however we can, but give Angie a call. Send him over to Angie Peacock, because that's her background and she knows that so much better than I do. Sometimes it's about referring people to the right place to get help,
Well, that's
and
the
having
right
that
thing to do.
and
That's
having that network. Yeah. And I think we both saw the world in that aspect where, we're just about trying to get people are individual, they're going to need their own path. And maybe some of that they can find with us, some of that they're going to find other places, but it's about helping people find the answers that they're looking for.
well, and the need is huge. I mean,
Absolutely.
even there's the benzodiazepine affected folks, and that's just it's a I think we have no idea the prevalence, and
Yeah.
the more we talk, the more we hear about people that have been affected and need support. And then there's the whole um anxiety, the prevalence of anxiety in this country, especially, and you were talking about COVID, especially after COVID. I think there's just a tremendous
Yeah.
recognition that anxiety is.
Well, there's a lot of, yeah, I mean, anxiety comes out of the world from a lot of places, but especially from instability. And that instability can come from a pandemic, it can come from a war, it can come from all different kinds of places, but instability is such great breeding ground for anxiety. And,
Yeah.
you and I have both seen, because we had this conversation too about moving easing anxiety, moving into easing anxiety, which also includes adding more anxiety to part of our puzzle. So we support benzodiazepine dependence and withdrawal, and we support people with general anxiety. There's a lot of crossover there, as we all know. But that's why we do this, is we're trying to approach it from two sides, and help people not get on the drugs at the same time of people, get off the drugs who have become dependent on it. But also, I see so often, especially in youth, but also just in the world in general, anxiety is just shooting through the roof.
Yeah.
If you see the statistics, it's ridiculous.
It is, and it's certainly nobody owns it in terms of, like, is it a young people issue or an
No.
older person issue? It's really pervasive. But I think one of the things that we've certainly come to understand is that there are a lot of strategies and a lot of
Yeah.
approaches that that can be meaningful to people that are struggling. And I think the thing that I found when I was on a benzodiazepine, and maybe also when you're struggling with anxiety, is it's very hard to wade through what is going to work for you, and what is out there that we know and it's credible. And we've really talked about helping to be the translators for people, to be able
Yeah.
to help people understand what is an approach that might work for them.
Right, right, and that's exactly it, is we're passing on information that we've learned, but we're not telling people exactly what to do. It's more, here's information, here's resources, here's some things that we've learned, here's some of the research we've been involved with, here's some stuff that's going on. But we're not telling people what to do. It's still between that person and their own practitioner, own provider, on how they pursue things. But everybody's got different paths, everybody has different issues going on in their lives. And I think it's so important to address that and realize it's okay that, our box isn't, we don't have one box, it's like we don't have any boxes. We just have, let's take this one step at a time and move forward and,
Well,
get to.
you and I are a great example of, even though we were on the same medication in this case,
Yeah.
we had very different
Mhm.
experiences, and things that worked for us and didn't. But and so there is not one path, as you've said, but
Yeah.
there are some universal truths, and there are some
Yes.
ways that, but there isn't a one size fits all.
Right. I couldn't agree more. Yeah, I love that. I'm going to go ahead and start wrapping this first section up
Sure. Sure.
because, as I mentioned to everybody, we had already recorded this and lost the first half. And so this is us re-recording the first half. And at this point in the first half, we took a break. I was going to take a bathroom break. And so right after the end of here, you're going to see us picking up after that break.
Yeah.
And you're going to be able to say hi to my dog Murphy as he comes onto the
There
screen.
you
You'll see
go.
that here in a second. All right, Doreen,
Thank
that's enough
you.
for this half, and we'll jump in and pick it up where we left off earlier. Thanks so much.
Bye-bye.
Okay, I think we're back. Hopefully that all worked, and I restarted the recording. I had to start back up again as I came back from the restroom. Murphy, my dog, came to say hi. So there's Murphy. Say hi, Murphy. Can you say hi, bud? Hi.
Murphy is a very sweet dog.
He really is. He's just out. He's smelling my chai. So,
Yeah.
which is part of why I needed the break. I've been drinking caffeine this morning, which is like a no-no when I do these things, but I couldn't help myself, and of course, I had to make a run to the restroom. So, thank you for letting us pause that there for a moment
Sure.
as we get back. I see you. I know you want to be part of this. I know. As I talk to my dog in the process. Um, but we were starting to get some interesting things, and I wanted to start shifting into that a little bit about kind of our philosophy and what we're doing. And I want to give a little precursor. There'll be another podcast coming out in let's see here. We're gonna have one coming out probably in early December, and that one is going to be focused on the specifics of easing anxiety. And oh, I didn't mean to switch that. There we go. We're still here, and that's going to be the specifics of easing anxiety. So look for that one. We're kind of going to be our announcement of what's coming in January and February and the rest of 2024. So that's kind of our big launch. So we're not talking a lot of specifics today, but we want to talk a bit about behind the scenes, what's been going on with Doreen and I, what we've been working on, why we're looking at these changes, what's coming down the pike for us, and just kind of get a little flavor of what we were looking into. And let's start a little bit with this monetization thing, because that's kind of a part of all this behind it. And I wanted to talk a little bit about that. I've been honest with everybody on our podcast that eventually we need to find a way that this site, support site, podcast, everything else we do can be sustainable financially. Um, as you all know, I've been hosting this podcast for 4.5 years now, and I have yet to cover my expenses any one of those years. So I've always been at a loss, and we just can't keep doing that. It just isn't feasible. And I know a lot of other organizers within the Benzo community who are struggling with the same thing, and they're trying to figure out, how can I make a career out of this? How can we keep going with this? And of course, without some income. So I mentioned to you that we're building a site here at Easing Anxiety. So some of you have already subscribed to that site. There's not much there yet, but that's we're going to talk about, and that's what's coming. But I wanted to mention that one of the reasons we needed to monetize was for that reason. Even though Doreen and myself and everybody else involved, that's not our primary driver, but it is something that we need to have there to sustain it. It needs to be. I really would like people involved with our site to be reimbursed for their time, especially people who are benzo injured and want to come over and maybe coach or maybe do blog material or do something that we have an environment where those people then can actually get paid for their work, so that so many of us have lost jobs and lost careers of what we've been through, and I'd love to create that kind of environment. So I just said a whole mouthful there, Doreen. Do you want to pipe in and
You know,
say what your thoughts are on that whole topic?
one of the things that I think I never really thought about is the amount that you've invested in setting up, that to even do blogs and podcasts, you have to have project management software. You have to have so many different tools and software that you've invested in that none of us that have benefited from what you've offered before have even considered. And so I think that, um, as you said, neither one of us is looking to is looking for a lot, but we have to support ourselves,
Yeah,
and that's what
exactly.
you're talking about. And so, but to do that, and Dee and I talk all the time about that we only can do what we do if we provide value to the community. And
Yeah.
so we really are very focused on what is what is valuable, what is meaningful.
Yeah, exactly. And I want to make sure I preface all that too with in the past we've taken donations here and there have been some totally amazing people who have donated to Benzo Free Podcast and to the Easing Anxiety site. And I just want to be so thankful. Unfortunately, it would just take a huge amount of donations to actually wind up offsetting our expenses. But those donations have done that some months and have been amazing. And especially a few of them who are just there almost every month coming through with money to support us. And I'm so grateful. And if you want to check it out, those people are listed on our site of the people who have been our regular contributors. And we're really grateful for that. But we thought maybe moving into less of a donation minded, thing to more of a membership or, some kind of structure like that made more sense. And so that's kind of why we've been easing into that direction. You can't, it's really difficult for us to sustain ourselves based on a donation platform. It just doesn't quite work. So,
Do you want to talk about in broad strokes some of
yeah.
the ways that we see easing anxiety growing and building and evolving?
Yeah, I would love to. Let's both talk about she's prompting me even though she's been equally part of these conversations as I have. So this is from both of us.
No, it's both of
Um,
us. Yeah.
I know that's what I love. And this is see, I'm really glad we're doing this because I want people to get to know you better. I know a lot of people have been listening to me for a long time and following me, and there's a trust that builds with that, and I love that. I never, of course, want to betray that. I just want to make sure build on that, and I want that same for you as you're coming over here. And so the blog post, but now doing more of the content here with me is going to get your face out there. People are going to get to know you and start to understand who you are, and I love this because you're going to be part of that process too. So I'm excited to see people having a chance to get to know Doreen because I want this to spread out to be a lot more than me as we expand easing anxiety. But um, yeah, as you were mentioning with the platform, we've had these kind of circular conversations over and over again, and often Doreen and I have been coming back many times to, well, maybe we should include this, or we should know well, we could do this, but we should launch this. What about launching? No, let's go back over here, and it's good. It's been an organic discussion, and I think it's what we had to do because we were brainstorming and we were figuring out. Now we're starting to get a plan in place for how we're bringing this forward. And I think we've broken this down, and you can elaborate on this for me, Doreen, if you don't mind, into two basic areas that we're looking at. And one is the content, which is what we've been doing mostly all along. And the other is what we don't really have a title for it. It's community, it's services. We're still kind of figuring out what that name is. So, community and services would be more coaching or support groups or online, forums or online chats, or we would have office hours, that kind of thing with people, or something where they could contact us and we could do live streams. And that's that community that we're still building. But then there's the content. And we decided, well, the content is the thing that got us here. And so we want to really get that consistent and get that formed and moving forward. So we're focusing on the content first, and then with that services piece, hopefully coming in, after as we keep moving with the content. Can you elaborate a little more than what I'm kind of just throwing it out there,
I
Doreen?
think that
So
this is very much what we've been talking about. And so, what is it that you offer a community? And so, not only do we come with our professional expertise, but really lived experience. Uh, and I think the question is when you think about offering something to a community, it has to be, I mean, Dee and I talk a lot about listening to the community. And so as we evolve into whether it's a membership or a subscription, we're very interested in hearing from everyone about how this is meeting needs and aligning with the journeys that people need to go on or want to go on. And so the content is making sense out of the huge flood, a tsunami of information and content out there, both in the benzo space and in the anxiety space. And then that's one piece. The other part of the content is that we're very blessed to be connected to people that are experts in these many fields, and we can bring them to the fore. We can help focus conversations that we think are going to be helpful to members and the community. And
Absolutely.
there's also so many things that we hear about, from whether a vegan diet is important, or
Mhm.
what herb do you use, or
Mhm.
is EMDR a helpful tool for anxiety? Well, what we have been talking about, really focusing on, is being able to analyze what is known about those tools and techniques, but not necessarily taking a position, because there's but presenting what is known, what the evidence is, and what the risks and benefits are. So I
Excuse me.
think that's
No, I love you're nailing the things that I'm thinking, and I love it. You're coming out with them very clearly, and I love that you're saying that. I just want to back
we've
up what
had
you said.
6 months of conversations
I
about this.
know, I know, I know, but it's so funny to hear things that you and I have talked about to come out, and come out in a conversation like this. It's just, I
Sure.
love it. What you said feeds exactly into. You're right. We want to make sure one of the things where I think we can differentiate ourselves a little bit, and I'm not. This is not against any other groups in the community. It's just more. We're definitely evidence focused. We're definitely background focused. So we want to make sure that I've been very careful on the podcast for years of not recommending substances, not recommending adjunctive, medications, not recommending all these things because number one, we're not medical professionals, so we can't do that. But also, people are different, and we want to see the research. And so, one of the things that we definitely have here at Easing Anxiety is we have a strong research background
Yeah.
in what the work we've done. Alliance works. I mean, Doreen works over at the Alliance, is on the board there, and they are the ones that are sponsoring a lot of the research that's been going on. So she really knows what's been happening over there. And I've been on several of the research teams and authored several of the papers. So, and right now, in fact, we're doing one that's a systematic review of benzodiazepine literature on bind or bind-like conditions. And I mean, I'm reading thousands of abstracts of articles on benzo. So you can't help but start to absorb some of that. And that really helps. And so we want to make sure that we have backing for what we do. And that's one of the reasons why we're so closely tied in with research, with other nonprofit organizations like the Alliance, like BIC, because they're often the ones that are actually behind some of that research and behind trying to find evidence to say, hey, by the way, we just found out that, ashwagandha or something is really beneficial coming through that or not.
Or not.
Um,
Yeah.
but as Doreen also mentioned, we don't want to come down necessarily as yes or no. We want to help provide the information to you so that you and your medical team can make the decision of what's best for you, coming off drugs or dealing with anxiety.
And I think the other piece is that, and maybe we haven't used this term, but it's almost like with with all the literature that you've looked at, what we're trying to do is to translate that to folks that are on a day-to-day basis struggling with benzodiazepine issues and anxiety issues. And so none of us really have the capacity, when we're dealing with the difficult issues that we've been talking about here, to understand what all this research shows and what it doesn't and what the limits are. And so what we want to do is to be like translators for our community.
Yes.
And in translating, it's not dictating. And I think that that's a really important distinction that we can make.
I feel like we kind of have that witch's brew, the brew that we're kind of stirring, and we're combining in some evidence. We're combining in our own personal experiences. We're combining in the experiences of other individuals we worked with, and it kind of creates this kind of. So we're not just saying, "Oh, here's the evidence there," but we're also saying, "Here's the evidence. Here's how we kind of see that maybe ties into somebody going through benzo withdrawal. Here's what I've done, and I've seen that too." So we can share anecdotal and research, but we always make sure that we say where it's coming from. And that's one of the things I want to make sure. Like when I tell you my story, I always emphasize it's my story and that your story is going to be different. It's going to be, we all have different paths through this. One of the things we do want to say is that with all the work that's going on here, we don't want to forget that human element. And that's where it's kind of been nice for me. And Doreen, you can add to this because the research is great and it feeds that logical side of me. So I do some data analysis for them and we do the
Right.
research and we go through the papers and that feeds that. But I also have that, the right brain. I have that creative emotional side, and that's where the podcast has always come in. And one of the things that a word that keeps coming up for both Doreen and I is connection. And that's the one thing we never want to lose. So we have the informational background. I believe we have a really strong foundation and knowledge of kind of what has happened and what's working, but we want to make sure we always combine that with that human connection. In fact, Doreen and I started adding an AI disclaimer to the bottom of our
Right.
blogs, and Doreen started doing it too. And it basically says this blog was written by I think a human person. Probably a little redundant, but it's basically that we write our own blogs. While yes, some research may be attributed to, if you do a Google research or using AI, it just kind of happens naturally. But all the writing is done by human beings. All the relation of what we've been through is from human beings. And we're always going to try to stay true to that. So it's something. So what I'm trying to say is there's that connection that we have by sharing our personal stories and sharing our lives and sharing the lives of others back and forth that really seems to have been beneficial to many people listening to this podcast. And that's the other focus that Doreen and I want to make sure you understand we will stay focused to. And that's part of that compassionate, responsibility we talked about. Doreen, you want to elaborate on that any?
Well, no, I think that, we've talked about we want to make sure that every interaction is based on decency, that nobody, there's not a space for anybody to put anybody else down or
Mhm.
to say that and that's not right. It's just not what we're about.
Right.
We are really talking about there's a way in everything we do, whether we're able to, as we evolve into more and more services, whether it's support groups or coaching, that there is a fundamental respect for each other and each other's experience. And that we're there to usher and guide the process along, but we're not there to put anybody's experience away
Absolutely.
or down.
Absolutely. Yeah, I agree. And just so you know, real quick, in case you hear clicking in the background, it's my dog chewing on a bone next to me. So I apologize if that's coming through on the mic. I hope it's not, but he's chewing on a nylabone, so it's kind of coming through.
Yeah.
But I think that's the thing we want to stay really true to. Yes, is that personal connection, um, the understanding, the compassion, and like you said, just common respect for one another, and common caring for one another. That's what we're built on. And I want to make sure we always maintain that kindness matters. And, while I don't, necessarily always agree that, we should dictate, how you treat somebody, but I think it's always good to encourage people just to treat people with respect. And so we take that approach, and it's something we're going to make sure we kind of keep going forward with is that type of thing. But one of the things that Doreen and I also have talked about, Dreams really pushed this, and I love it. And I've been the one, haven't been ready to pass it out yet. But Doreen has really been pushing, trying to get us to find out what you think. And I totally agree with it. I just haven't had a chance to kind of get up to speed with it. But it's something we wanted to mention here, which is we this is an organization that many of you helped us build. You've helped us get here. And in fact, we're involving some of you. We've already reached out to some people and pulled them in
Yeah.
to be part of what we're doing here, and we'll talk more about that in the upcoming podcast. But we want to make sure that you understand, we'd like to know what you think of this. Like, what would you find most valuable? And one of the things we're going to put up pretty soon on the website is this is the Doreen's baby is a survey. We want to get a survey out there of what are you looking for. So we're going to get that online here within the next few weeks. But even right now, we can get a taste of things. And if you want to give us some feedback, we'd love to hear from you, right, Doreen?
Absolutely. So we may come forward with sets of ideas, whether it's office hours um, or certain kinds of online presence and support, and it might not be right. And if it's not right, we don't want to keep doing it. but
Yeah.
if but if it is supportive, or if there's a way to turn it 10 degrees to the left that's going to make it more meaningful, then we are going to do that. And so the more feedback you give us on the feedback form that Dee just, or the link Dee just put up, or comments, and any other way that, or emails to us, I think it would be welcome. Um, so
I love that. I agree. And that, yeah, we said the feedback form. I'll say it too. It's easinganxiety.com/feedback. We just had it on the screen. You can always go there and both of us will review those and look at those as they come in. And also, of course, if you have the email address, you can always send us to that too, or even just comment on YouTube. We'll try to pay attention, especially on this one. I'll make sure I look at the YouTube comments. So if you just want to
yeah,
comment on YouTube to this too, that'd be a great way to communicate with us of what you're looking for. And once we get that survey on there, it will go out to the mailing list. So, make sure you're on the mailing list. That's helpful to do that. So you'll get that invite to come join us and tell us more about it, about what your thoughts are and what you might be wanting, for what we're looking to do here. We really want this to be, again, it's always been, and I've said this from day one of the podcast, that this is your podcast. And the same for this site. This is, I mean, we haven't been doing this, and I haven't been doing this for 4.5 years, just because I like talking to a microphone. I do it because the feedback we get from you all is that this has helped. And so we want to make sure we keep going in that direction of what's helping. Is it coaching you're really looking for? You're looking for a support group. You're looking for content specific to this or that. You really want to know more about, hypersensitivity, and you want to know, how do I deal with, light issues if the light's too bright, or I got depersonalization, DPD, whatever it is. We want to know from you what you want to hear, and that will lead our content. That will help guide us. We look at that stuff, and sometimes we go, oh, I probably should get a blog post out today. What should it be on? We have those questions, and that's where that kind of input really helps, because we can go to those and say, oh, so and so mentioned that she'd like to see more about this. Oh, well, Doreen, you want to take that, or you want me to? And one of us will take it, and we'll do some research, and we'll work up a post, or we'll do a podcast on it. This is where the content comes from. You all are part of that, and a vital part of it, and we really appreciate it.
the only thing I would add is what we haven't talked about yet is that I particularly am very interested in the issue of older adults and anxiety, or older adults and
Mhm.
benzodiazepines. Uh, and Dee, you've talked about, you feel like there's not enough support for men and
Yeah,
anxiety. So if there are specific topical issues that either we can facilitate or we can find people that will fill that need. Um,
absolutely. Yeah, in
so
fact, one of the first conversations you and I had was, I don't know which one of us mentioned it first, whether it's me or you, but I think you mentioned about like a women's group or a women's subgroup, and I mentioned about a men's group, and it's like, oh, well, this would be kind of nice to break it up a little bit. So yeah, I'm hoping things like that. It's like some subsets of, men's groups or women's groups, or groups focused on, older people or younger people, or it doesn't matter. It's just sometimes there are specific, needs of different populations, subpopulations that can be addressed in that. I think those are great things. We don't want to ever make them exclusionary, and that's not our goal. But our goal is to help to address some things that might be. The reason I said men's group is I can't tell you the number of times I've been hearing from people lately who said, my husband's really struggling, or and they don't know where to go. And for men, I know it's often more difficult sometimes for them to seek counseling or seek therapy. So one of the things we'd like to do is not just for men, but also for women, but to be an alternative for people who may not be comfortable with that or not be able to get help, but maybe peer coaching, and that's more what we do, but maybe more of a peer approach is a place to go to that can also provide support for those people where it's a little more comfortable, or a little different. We're not certified counselors, we're not acting that, although some of the people that are helping us are. um, we're presenting ourselves just as peers, and peers that have been through it, peers who have done some research, and peers who get it and are here to try to help if we can. That's all. Does that make sense? Or
yeah, yeah.
okay.
And again, I think the more we hear from you all, the
Yeah,
more targeted and meaningful this is going to be.
yeah,
So,
absolutely.
and we have to say that we really talking about doing everything on a digital online platform,
Mhm.
but at some point, you've talked about
Yeah.
maybe moving, and this is not tomorrow, but moving
No.
into face to face. But
Yeah, I would love to do that. I mean, I teaching background, and I loved teaching face to face. I mean, the virtual is really nice to have that, but I'd like to get out there and start to meet people and actually talk people and maybe do some seminars, do some get-togethers, do some meet and greets. In fact, I was toying with the idea. I'm going to Orlando this in January, and I was toying with the idea, although I don't think it's ever developed, about just setting something up there while I'm there and see if people might want to come down and and meet with me for a little bit, or we can talk about our stories, or we can actually do a seminar, or do a lecture of some kind, or just whatever it would look like. And I think we're just feeling it out, and that's why it seems a little scrambled, but eventually get to where we start to do some events, some live events, and Doreen and I both and other members of Easing Anxiety can go out to different locations and meet with people face to face. And I think that's really an important part of what we're doing. So I think that's a great point, Doreen. We don't want to stay totally online. We don't want to stay totally digital. We really want to get out there and start to meet people and talk to people, even though we realize that is hard for some members of this
Yeah.
population. And for some people that doesn't work. Trust me, we're not dropping the virtual because that's how we've reached you. But for some people, I think that's also very valuable to get together with others and say, hey, one of the things, and I'm almost about to break down because when I talk about this, it always gets me emotional. I can't help it. But when people write into me and say, like, I fall asleep to your podcast, because my voice was soothing or something related. And I realize some people might take that wrong, but I don't. Because for some of those people, they haven't slept in 4 days. And listening to the podcast, and it's not that my voice is great. I think my lower voice is soothing and helps sometimes. It's not that our content is great. It's not that it's me. It's that, and I've heard this before, they have a friend next to them. When they listen to it, it's that somebody's there talking and they don't feel so alone, so isolated. And that stuff just tears me up when I hear it, and it tears me up when I try to share it. But that's what always has kept me going. That's what keeps us going. That's what keeps us trying to grow this. That's what helps to. I just recorded a podcast that was more personal, and you can go back and listen to that one a few days ago. But one thing I didn't mention in there, but I wanted to mention, was there's a high risk of burnout in the benzo community.
Yeah.
And Doreen has seen this too. And it's like, so many people come along, do videos, do, TikToks, do podcasts, do blogs for a while, but most don't last more than a couple years, and they go on. Either they've gotten better and they're moving on to their new life, or it's just, this is really hard sometimes. And it takes all of you and a lot of you. One of the reasons I haven't posted a lot or didn't have a podcast in the last couple months is because I had to do some self-care. It's that simple. I needed some self-care, and I needed to do that. And Doreen and I were working behind the scenes that whole time, but I was having some hard days and going through that. And that I share with you, and I shared with you on that last podcast of what I'm going through. So that's what we will keep doing. And I want to always be, and anybody who comes on board with Doreen and I here, that's one of our principles, is to be authentic, to be real, to share our experiences, be vulnerable. So, you're listening to somebody who gets it. That's what I think it's about. I don't, maybe you can elaborate on that, Doreen.
No, I think
I'm gonna grab my tissue now because
well,
I
but
get all teary.
I think it really is the concept of, in this community, you cannot, maybe the greatest gift is letting somebody know that they're not alone, and that they are not the only one going through this. And even if your experiences might be different, so Dee's, your experience might be different than mine, we have enough shared experience to recognize that in the other person. And that's,
I love that.
that goes a
Thanks.
long way.
Yeah, it does. Well, we've been talking pretty good for a while, and I think we should probably start to wrap things up, if that's
Yeah.
okay. Also, we want to save a lot of us. We haven't talked a lot of specifics about easing anxiety, but hang on, in probably the first or second week of December, we're going to have a podcast coming out. Doreen and I will both be on it, just like we are here, but hopefully I'll understand the software better, and can drive a little better. But we'll be on, and we are going to provide specifics of what's coming in January and February of next year. So, and throughout the rest of next year, we have plans in place. We're really excited about them. They're coming down, and I think they're a lot of what y'all are looking for. But don't forget to let us know via feedback of what you might want to see. what you're looking for, what's going to help you, where we've helped you in the past, how we could help you differently in the future. That's what we're looking for, and we want to know what that is. So do that. And of course, don't feel free to check out our website, easinganxiety.com, because if you're only listening to the podcast or only seeing us on YouTube, you're not seeing our blog content. So two ways to do that. One is subscribe to the newsletter, which you can do at easinganxiety.com/subscribe. And another way is to just go to our website and just see what's recent. You can see all our blog posts on there, all our podcasts. It's the one place where you can find all the stuff we do. Everything is on our website, so it's a good place to go check us out. Doreen, how would you like to close out? What would you like to have your last words on this one be
Wow.
before we do the next one? So,
That's big. I think as you were talking, the thing that came to mind is I never saw myself as somebody that was anxious. I didn't. And then as I have been talking to Dee, I realize that that's personal smoke and mirrors. That really underneath it, there was um, issues with anxiety that I could identify. And I wrote a blog post called Owning Anxiety. And I'm going to have to say more about that because I was comfortable with an identity that I had fibromyalgia. I was comfortable saying I was somebody that experienced chronic pain. But it took me a minute to realize I want to be comfortable saying um, that anxiety is a part of my life too, and it comes and goes, and it might manifest itself differently than others. But there's kind of an owning of it that I appreciate. So that's the
and
only thing I would end with.
and to tack onto that, Doreen and I have actually been coaching each other because she shared with me some of her anxieties, and I talked with her, and then I get on and have a rough day, and she would talk me through some things. And this is what friends do.
Right.
We help each other out, and this is the whole basis of coaching. It's the whole basis of peer support. We are 100% peer support, and that's what we do. And this is the reason we're here. So thank you, Doreen, so much for being on the podcast today.
Thank you.
Um, for those of you out there, you're going to see a lot more of Doreen on our content. Please check out her blog posts, learn more about it. We got other people coming on board too. Hopefully, we'll be writing some things and be more involved in what's coming down the pike. Like I mentioned, we have another one coming out in early December. That's going to be on more specifically the content that's coming. Please let us know what your thoughts are. So, I am going to close out now, and you saw the disclaimer. Please remember, never come off benzodiazepines or taper up benzodiazepine without some professional help. It can be very risky, and anything we said here is for informational purposes and should never be considered medical advice. I always want to squeeze that in. And I think that's it. Our next episode will be episode 129. And it might be that one. It might be one before that. Who knows? We're going to keep popping them out as we get. We're going to get more content out. That's what's coming. We're getting more content, and that's building what we're doing here. So just remember, as I always tell you all, keep calm, taper slowly, and take care of yourself. We'll see you next time.